Good morning, everyone. I'm Paul Miller, MPP for Hamilton East-Stoney Creek. Today, I'm presenting Bill 6, a private member's bill. It is an act to amend the Ministry of Community and Social Services Act to establish the Social Assistance Research Commission. Today, I'm joined by Laura Cattari from the Fix the Gap campaign and by Peter Clutterbuck from the Social Planning Network of Ontario. Ontario's desperately low assistance programs leaves families hungry, underhoused, and sick. Over 900,000 people rely on Ontario Works or the Ontario Disability Support Program, but more than half of these families don't even have enough to eat. Currently, provincial social assistance benefits are arbitrary numbers that come nowhere close to reflecting the real costs of rent, food, and other basic necessities in our communities. People on OW and ODSP have among the lowest incomes in our province. Yet the decisions about their incomes are not based on evidence about the real cost of living. They are arbitrary political choices made behind closed doors. Social policy making in Ontario should be based on evidence and research. The gross inadequacy of social assistance is one of the main contributors to persistent child poverty, food insecurity, unequal health, and educational outcomes in Ontario. An independent, evidence-based commission to recommend social assistance rates will provide the government and the public with the information it needs to debate social assistance policy and set adequate social assistance rates in Ontario communities. The panel will have representation from the people with direct lived experience on OW or ODSP. This is about fairness for Ontario in the direst need for Ontarians, many of whom are unable to work and many of whom are struggling to support children and loved ones. And now I'd like to pass it over to Laura.
Thank you. Fix the Gap arose from what we saw around us. Basically, we have people trying to meet their needs and finding they can't make ends meet. They can't afford rent and hydro and food, let alone clothing or any activities for their children. I think people understand this. But when you get to our basic social safety net in the province, the one of last resort, it's broken. And it has a huge gap in understanding what it costs to live in Ontario, a huge gap in data and evidence-based materials, and the largest gap is with inclusion of people in this province. At Fix the Gap, we're hoping not only will Bill 6 pass, but it'll form part of decision-making in Ontario. And it can lead to a lot of other discussions around WSIB, EI, how it works with the social assistance system. But first and foremost, for someone like myself who has lived on ODSP for 12 years, it'll help make sure that whatever I'm given in supports will actually support me and not cost the system more. And that's what we're looking at.
Thank you, Laura. Peter?
I'm happy to be here for the Social Planning Network of Ontario, representing 20 social planning community development councils across the province, and Poverty Free Ontario Network, which has community leaders and organizations in another 25 communities that are seeking to eradicate poverty and working hard on it. Social planning research has shown over the years, our own and joined with other organizations, what the tremendous personal cost to health and well-being for people on social assistance and living below the poverty line. We joined with the University of Toronto Wellesley Institute in 2009 to do a research report which shows that rates of diabetes, heart disease, chronic bronchitis, and mood disorders occur 4.5 times higher among social assistance recipients than the average person in Ontario. And suicide attempts 10 times higher. Other research called Poverty is Making Us Sick actually pointed out that a $1,000 annual income increase to the poorest fifth of Ontario households would result in 10,000 fewer chronic health problems, conditions, and 6,600 fewer disability days lost every 2 weeks at work. So there's clearly significant damage being done to both people and to our economy as a result of tolerating poverty. Interestingly enough, this $1,000 a year increase for social assistance recipients is quite consistent with our own support for the $100 a month healthy food supplement, which would actually add to social assistance rates and be $1,200 a year increase over time. And this was so compelling that it actually got the endorsement of many municipalities and public health departments across the province, and convinced the Lankin and Shake Commission to recommend to the government that the $100 a month healthy food supplement be introduced as the first step towards adequacy in social assistance recipients. Yet, since 2003, what are called increases of 1 or 2%, except for the last few years, are really just cost of living adjustments. In the last few years, there's been some real increases for the first time since the mid-1990s, but nowhere near what's needed, because actually a single person on OW is still $12,000 below the poverty line. We know that MPPs understand the cost of living, because we actually took an exercise to them several years ago called Do the Math. They joined with 5,000 other Ontarians in actually forming a frugal monthly budget, what it would actually cost to live in Ontario, rent, food, utilities, other basic necessities of life. And the average cost of living that the MPPs came up with was $1,314 a month. Across all parties, only $100 difference among all the MPPs, which is $729 short of what the Ontario Works benefit was at the time. So Bill 6 creates an opportunity to establish an independent, evidence-based approach to social assistance rates based on the real cost of living, based on expert researchers who make up the commission, plus the important voices of people who live on OW and ODSP and their lived experience. This kind of legislation may give the force and the weight, yet to help our MPPs point out to the larger population that this is an important issue to deal with, to eliminate poverty, and an independent commission gives them some evidence and I hope some courage to kind of make the changes that need to happen. We're encouraged by the strong support in the first reading. We hope to see the same kind of support and eventual passage of this bill over the next few months.